mynews.studio.
A metro train in Delhi has been wrapped with messages about women's health. The idea is to launch a campaign that could reach millions of people. Can a daily commute actually shift the future of public health?
Today's December 17th, 2025. Let's dive in. I have to ask, why choose a metro train for a women's health campaign? Is there something specific about this place and timing?
Good question. Sultanpur Metro Station is more than just a stop today. It's actually the launch site for a month-long campaign by the World Health Organization and India's Ministry of Health. Their focus is on women's and girls' health, and they're using one of Delhi's busiest public spaces, the metro system. This goes beyond posters. The train itself carries the message, healthy women equals healthy nations, and the hashtag, because she matters.
So people riding the metro every day are basically traveling inside a moving classroom. What kind of content are they seeing?
It's a mix of topics. There's information on women's safety, mental health, digital inclusion, tuberculosis, and the right to live free from violence. The timing is important. It's right after the global 16 days of activism against gender-based violence. The idea is to keep the message visible, not just for a day, but for a whole month.
Who's running this? Is it only government bodies, or are other groups involved too?
It's a partnership. Senior WHO officials and leaders from India's Ministry of Health were on the first ride. They're also bringing in youth groups, like the WHO Youth Council. And there was an all-women band, Weebor, performing on the train. The idea is to move the conversation out of clinics and into everyday life.
The scale must be huge. Delhi Metro serves millions, right?
Exactly. This campaign runs from December 10th to January 10th. It's not just the trains. Some stations are part of it too. The strategy is about repeated exposure. People see these messages every day as they commute.
But what are the actual messages? Is it just general info, or are people being asked to act in specific ways?
It's a bit of both. For instance, messages about women's safety and dignity frame health as linked to freedom from violence. Mental health content encourages people to seek help and treat it as a normal part of well-being. There's also material on the digital divide. Many women still don't have access to online information or economic opportunities.
I notice the PCP-NDT Act is part of this. That's the law against prenatal sex determination, right?
Yes, exactly. It's about preventing female feticide and correcting skewed sex ratios. By including it, the campaign is linking gender, law, and health in a public setting.
Tuberculosis is highlighted too. Why bring TB into a women's health campaign?
Delhi has a high TB burden, over 98,000 cases reported between January and October this year. Women often care for families, so undiagnosed TB can affect everyone at home. The campaign is pushing early screening and treatment, tying into the wider TB Mukt Bharat Abhiyan.
So it's about drawing connections, violence, mental health, law, infection, all in one space. But why frame it as nation-building?
India's Health Secretary Punya Salila Srivastava said it directly. A family or a nation can't progress unless women are healthy. WHO's Dr. Katharina Boehm has called women the pillars of family and national health. The framing moves women's health from a private concern to a public priority.
So it's less about one group's health, more about the resilience of society as a whole. Is there any evidence this approach actually works?
There's concrete data on service uptake. For example, in 2025, Delhi screened 878,000 people for TB and did 380,000 chest X-rays. When people are aware and services are accessible, early detection goes up. The Metro campaign will monitor ridership, digital engagement, and use of health services to measure its effect.
But is there a risk this only reaches urban commuters? How do rural or marginalized women get these messages?
The Metro is just the starting point. WHO is extending the campaign onto digital platforms, national and state media, and through local health workers. The aim is to take these messages beyond the city, adapting them to rural areas as needed.
Do you think this metro plus digital strategy could work in other countries as well?
That's the key question. This approach treats mass transit as a public health broadcast system. With World Health Organizations, other countries could try it if they adapt the content for their own settings and needs.
How will we know if it's been successful over time?
They'll track indicators like TB incidence and treatment, mental health service usage, sex ratio at birth, and public awareness of rights. The goal is more than a short-term boost. It's about lasting changes in knowledge and behavior.
So, using existing infrastructure to make tough conversations about law, health, and gender part of daily life. Does the scale of India make this globally relevant?
It does. Even small improvements in India affect global health figures. The campaign is a model, a government WHO partnership, data-driven targeting, and a message that ties women's health to the future of the nation.
From a single metro train in Delhi to a possible global example, can public infrastructure actually drive social change?
That's what they're testing. If it succeeds here, it could work anywhere that mass transit and public health challenges overlap.
So, we've come full circle. A metro train acting as a megaphone, not just for Delhi, but possibly for the world.
Thanks for joining us as we unpacked how a Delhi metro campaign is reshaping women's health, making it both a national and potentially a global priority.
We broke down how public spaces can promote awareness, why women's health matters to everyone, and how data and partnerships can make campaigns like this measurable and scalable.
Thank you for listening. This episode was brought to you by mynews.studio. Try it now for free.